This is the course of INICET Grand Test Review Book, which includes all INICET previous year questions and Grand Test. Only the value points and high yield points of the INICET Grand Test is added and PYQs. Okay, so the first is for parathyroid adenoma, you do sestamibis scan. Okay, and after that you do focus parathyroidectomy, because by sestamibis scan you will get to know which parathyroid is to be removed and which show increase uptake. After that, in the parathyroidectomy, according to the Miami's criteria, if the fall in parathyroid hormone level is more than 50% during the resection or surgery of parathyroid adenoma, then it is adequate resection. And if the fall is less than 50%, then the bilateral neck exploration has to be done. One more point, so you have to annotate the Miami's criteria for parathyroid surgery. Next is, if the creatinine clearance is less than 60 ml per minute and the serum calcium is more than 12 milligram per deciliter, then the surgery is mandated. In this case, surgery is mandatory. Then the formula of half-life is there. If the half-life formula is 0.693 into volume of distribution by clearance, now this was the half-life of digoxin. You will given the values of Vd and the clearance, so you have to calculate the half-life, so which is equal to 42 hours in the case of digoxin. Then for celiac disease, classification was asked. What was classification used? So it is Marsh classification. Similarly, write in your book, for acute ulcerative colitis, acute severe ulcerative colitis, Truelove-Witts classification. Truelove-Witts classification is used. Okay, then it was asked that which HLA are involved in celiac disease, HLA DQ2 and DQ8, and association of celiac disease is with dermatitis herpetiformis. Then for electrolyte estimation, so you should know about the vacutainers. So green vacutainer contain heparin and used for electrolyte estimation. Similarly, the purple top vial contains EDTA, okay, used for doing CBC. Then yellow vacutainer, it contains acid citrate dextrose used for HLA typing and RBC preservation. Then gray vacutainer, it contains sodium fluoride. So this sodium fluoride inhibits the enolase. This is the biochemistry link. It inhibits the enolase and used for blood glucose estimation. Then in the question, the clincher will be given like if a gardener in Himachal gardener is there and there are ulcers on his arm along the lymph nodes. There are along the lymph vessels there are black ulcers on the arm, okay, and forearm. So what is the fungus which is involved? It is Sporothrix shankai, okay. Sporothrix shankai. So this is the clincher that the gardener will be given. So you have to reach the correct option by identifying it. Okay, so I have included the clinchers and value points or buzzwords by which you can reach the correct option, and that is how a good candidate solves the question. And this Porothrix shankai is a dimorphic fungus. Then types of surgical nodes. So this is the recent NEET PG 2025 question. So these NEET PG questions also come in INICET, and INICET questions also come in NEET PG. So can you see this last note? This is surgeon's note. This was asked in NEET PG 25. This surgeon note you can see. Then just remember three notes: reef note, granny note, and surgeon's note. So in granny note, crossings are opposite, but in reef note or scare note, the crossings are same, and the surgeon's note is quite different from them, you can see. Then investigation of choice for ureteric stones, it is NCCT KUB. This was May 2025 INICET PYQ. Okay, but all vaccine you will be given in more than 65 years age group. It's the influenza, herpes zoster, pneumococcal, Tdap booster, and COVID-19. Then what is the complication of diabetic retinopathy? So it is the May 2025 INICET question. It was repeated question. So many questions get repeated in INICET. So options were given like exudative retinal detachment, rhegmatogenous retinal detachment, tractional retinal detachment. So the complication of diabetic retinopathy is tractional retinal detachment. Then opacities in the eye, nebular, macular, and leukomastus. In nebular opacity, both iris and pupillary margin will be visible. In macular opacity, only the pupillary margin will be visible. And in leukomatous opacity, everything is white, nothing is visible. Then sebaceous gland, it is a holocrine gland. Then the viscoelastic substances, they prevent the collapse of anterior chamber during the capsulorhexis and IOL placement. So these viscoelastic substances are sodium hyaluronate, hydroxypropyl, methyl cellulose. Then for vitreoretinal surgery, the substances used are SF6, silicone oil, and perfluoropropene. Then it sometimes the question comes like, if the food is getting stuck between cheek and teeth, which muscle is involved? So answer is buccinator. Similarly, if the question is given like a person is not able to close his eyes, so which muscle is involved? Orbicularis oculi, and which is supplied by facial nerve. So candidates get confused in these. Then the sequence of steps in the research, actually this is partially it came in the NEET PG 2025. Okay, so you have to remember the order. Means it similar question was given in NEET PG 25. Hello everyone, this is the course of INICET Grand Test Review Book, which includes all INICET previous year questions and grand test. Only the value points and high yield points of the INICET grand test is added, and PYQs. Okay, so the first is for parathyroid adenoma, you do sestamibis scan. Okay, and after that you do focus parathyroidectomy, because by sestamibis scan you will get to know which parathyroid is to be removed and which show increased uptake. After that, in the parathyroidectomy, according to the Miami's criteria, if the fall in parathyroid hormone level is more than 50% during the resection or surgery of parathyroid adenoma, then it is adequate resection.